I'm Virginia Bernal, and here is a clinical case study on bipolar disorder. According to the Winger text, bipolar disorder is a mental disorder in which a patient experiences episodes of extreme change in mood and energy, ranging from severe depression to mania. Bipolar disorder is when a person is feeling really happy and then all of a sudden becoming sad, groggy and depressed. As these increasing and decreasing feelings happen, in between they feel normal. They have no excitement or under excitement. They feel normal at those times. At the point of feeling manic, meaning that they feel overconfident as well as extremely happy, these feelings also are accompanied by becoming really irritable, anxious, also coming to the point to where they make unreasonable decisions because of the over excitement over the feeling that they have. There are many medications out there that can be prescribed by a psychiatrist, either MD or DO, of whom are best medical personnel qualified to decide what drugs would be best for the patients in their cases and how severe they are. Here's a case study about a patient. A patient comes in for her first psychiatric session. Once the patient has answered questions about themselves, they begin to go into questions into their life and how life is going for them. The patient begins to explain of feelings of grogginess, sadness, and depression at times. She also said that she has moments of extreme excitement to the point of anxiety and irritability. She also mentioned that her friends have noticed that how she seems to be mood swinging, has a lot of anger at times, as well as sadness on different situations, that even though slight minor situations are large, the reaction is quite drastic. The psychiatrist then asks if she's ever heard of bipolar disorder, and added that the symptoms that she's having could be because of some form of this disorder. Bipolar disorder is a cognitive behavioral type of disorder, meaning that it links feelings to thoughts to behaviors, or behaviors to thoughts to feelings, and it is just a roller coaster either way. The patient replies to the fact that bipolar disorder runs in her family, and that she has a sister and a mother who also have been diagnosed with that disorder. This could be the cause because studies have shown, and this can be found on the National Institute of Mental Health website. They have found, or come to find, that it's a gene that can be passed down from relative to family to childhood and so forth, that can cause bipolar disorder. And the medications that can be prescribed are mood stabilizers, antidepressants, and also atypical psychotic generally are the ones prescribed. Some examples of brands for these antipsychotic medications are the olanzapine, which is also known as Zyprexa. There is quetiapine, which is also known as Seroquel, and then represendone, which is also known as Resperol, to name a few of the medications prescribed for some of these things. She will be evaluated for over the next few months to see how the therapy is working for her, to help that determine how long her treatment period will be. It's kind of hard to just give her a check-in, check-out kind of a time when it comes to these types of disorders. She will also return for a follow-up appointment in 2 weeks to see how and if the medication is working or if it has made any changes in her life. It's helping for the better or for the worse. And that is the case study there for the patient that has ended up being diagnosed with bipolar disorder. And thank you for tuning in. Appreciate it.